Thank you for choosing MNGI Digestive Health for care. This informational video has been created for our patients who are having the Bravo pH monitoring test. The Bravo pH test helps your provider diagnose and treat acid reflux by measuring and recording acid levels in your esophagus. The test begins when your physician places a small capsule on the wall of your esophagus. This capsule measures the acid levels and sends the information to a receiver that you will wear on your body. The capsule stays in place temporarily and will naturally pass through your stool after the test. There is no need to retrieve it. To ensure accurate results, it's important to follow a few preparation steps. Stop taking any acid reflux medications for at least 7 days before the test, unless directed otherwise by your provider. Do not take over-the-counter antacids within 24 hours of your exam. Avoid solid foods after 11:45 p.m. the night before your test. Avoid all clear liquids within 3 hours of your test time. During the test, you'll wear a small receiver near your body that collects data from the capsule. You'll also keep a Bravo diary to manually track the start and stop times of your meals and when you lie down. During the test, continue avoiding all acid suppression or antacid medications such as omeprazole, Zantac, Tums, Rolaids, Maalox, or Mylanta, unless your doctor says otherwise. Eat meals in one sitting instead of snacking throughout the day. Avoid sipping liquid slowly over time. Instead, drink the full cup at once. Avoid chewing gum, hard candies, snacking, or sipping drinks throughout the day. Try to eat foods and engage in activities that would typically trigger your symptoms. This will help your care team see how acid levels behave when symptoms occur. Let's walk through how to use your Bravo receiver, which collects data from the capsule inside your esophagus. The receiver screen will remain blank during the test to save battery. To wake it up, press any button once. The screen will light up and you'll be able to press the necessary buttons to log your symptoms or actions. Keep the receiver within 3 feet of yourself at all times. If it gets too far away, it will beep and the light will turn red, meaning it's disconnected. Move the receiver closer to your chest to re-establish the connection. A blue flashing light means the capsule is connected and recording. Use the provided belt to securely wear the receiver and be careful not to drop it or get it wet. You are responsible for any damage. The receiver has 5 buttons. Meal button, fork and knife icon. Press at the start of your meal. This activates a blinking light. When you finish eating, press it again to stop the blinking. Symptom buttons. Each of the buttons can be assigned to a different symptom, like heartburn or chest pains. You'll work with a nurse before the test to assign them. Press the button once when the symptoms begin. The light will flash briefly to confirm the press. Only press again if the symptoms change or worsen. Lie down button. Press this anytime you lie down or recline, including in a recliner. The light will blink while you are lying down. Press it again when you sit or stand to stop the blinking. Here are some frequently asked questions. What if I get up at night to use the bathroom? If you're only up briefly, you do not need to press the lie down button. Can I get an MRI during the test? No. You must wait 30 days after capsule placement before having an MRI. Should I press the lie down button if I'm just relaxing in a recliner? Yes. Anytime you recline or lie down, press the button. What if I continue to feel one of my symptoms? Only press the symptom button once at the onset. If symptoms worsen or change, you can press it again and make a note in your diary's comment section. After your test period is over, the test ends automatically and the receiver will shut off. Please return the receiver and your completed diary to any MNGI location during regular business hours. As a reminder, there's no need to retrieve or worry about the internal capsule. It will pass naturally in your stool. There is no need to memorize all this information. You'll receive written instructions to take home the day of your appointment. If you have any questions, please ask the nurse working with you before your test. Thank you for watching this informational video about your Bravo pH monitoring test.